everyone. Thank you all for joining us. As Chris said, my name is Cynthia Hallett, and I am the president and CEO of Americans for Non-Smokers' Rights and the American Non-Smokers' Rights Foundation. We are a national nonprofit public health advocacy organization that partners with coalitions all across the country to advocate for smoke-free air in workplaces and public places, which includes casinos. I'm excited that we have an incredible lineup of speakers today that represents the most important perspectives in this conversation about why going smoke-free is critical, particularly at this moment in time, as we start to emerge from the pandemic. We'll hear about the public health impacts, the challenges smoking presents for gaming employees, what avid casino guests prefer, how local governments can lead on the issue, and how tribal gaming has been outpacing their commercial counterparts over the past year. Momentum for smoke-free casinos across the country has been building because it's a common sense policy and based on public demand. Nearly half of all states, more than 160 tribal gaming properties, and nearly 1,100 casinos nationwide do not permit smoking indoors. These decisions reflect not only COVID-19 related public health considerations, but also opinion research that routinely shows the vast majority of guests prefer smoke-free casinos. This support is not surprising considering that the majority of adults are non-smokers, including 90% of young adults, a key market for gaming properties. Smoke-free indoor air policies have never been more commonplace than they are today. We are urging casinos to keep these policies in place even once the pandemic is behind us. Casinos like the ones in Atlantic City, Pennsylvania, and Michigan are learning to do business differently as they operate with the temporary smoke-free policy, including shifting smoking to outdoor areas so staff and guests can return to properties safely. This is good news for gaming workers. After all, tobacco use and secondhand smoke exposure kills nearly 500,000 Americans every year. Yet today, nearly 84% of casino workers breathe in secondhand smoke on the job. Even the most advanced air filtration systems are no match for the health benefits of a smoke-free indoor air environment that gaming employees and guests deserve. Now, I want to underscore this point. Even the best air filtration systems don't cut it when it comes to eliminating the risks associated with secondhand smoke. Don't take my word for it. This is what the American Society of Heating, Refrigeration, and Air Conditioning Engineers say, quote, "The only means of effectively eliminating health risks associated with indoor exposure is to ban smoking activity. No other engineering approaches, including current and advanced dilution ventilation or air cleaning technologies, have demonstrated or should be relied upon to control health risks from environmental tobacco smoke exposure in spaces where smoking occurs," end quote. Even the engineers who designed the best ventilation systems say they don't work to mitigate the health risks associated with secondhand smoke exposure. Going smoke-free is the best way to protect employee and public health. Over the past year, so many of us have become more conscious about the air we breathe, and that's going to be a lasting effect of the pandemic. People are less likely to spend time in places that could jeopardize their health. That's why going smoke-free is also good for business, because it will attract new customers who prefer a safe, healthy environment with smoke-free air. Smoke-free casinos also save money on expenses. Employee healthcare costs go down, workers take fewer sick days, productivity increases, and maintenance and cleaning costs decrease. We've heard the false predictions of economic doom and gloom that could result from casinos going smoke-free, but the reality is quite different. Many states with smoke-free air and commercial casinos have been reporting strong gaming revenue recovery this year, including Maryland, Ohio, Massachusetts, and Pennsylvania, all reporting all-time record gaming revenue increases. And in places like New Orleans, which went smoke-free 6 years ago this month, such predictions have failed to materialize. Casinos cannot be both a modern mainstream industry and still permit smoking indoors. In the year 2021, we take for granted that airplanes, restaurants, and bars will be smoke-free. In the very near future, we will look back at casinos the same way and wonder, what took so long? Now I'm thrilled to turn the conversation over to someone who knows the New Orleans story very well, Mayor LaToya Cantrell. The mayor has been a champion for smoke-free air and fought tirelessly for the ordinance when she was a city councilor. And it was my pleasure to be able to partner with her and the city as she worked hard on this issue. Mayor Cantrell?
Thank you, Cynthia, and thank you all for being together this morning as we do celebrate and earmark, I know for me and the city of New Orleans, 6 years that we have now been smoke-free. Absolutely was honored to lead this effort as a city councilwoman 6 years ago, along with my partner on the council at the time, Susan Guidry. We were told, no way that we would be able to get this done. But you know what? We had the courage. We stood up for our musicians who were saying that their lungs were their instruments. We stood up for all of our employees in restaurants, in bars, in our casino, who said that we shouldn't have to die to earn an honest living. And so we took their voices not only very seriously, but we took them at heart and did what it was required to come out with a 7-0 vote. And I have to say, when I went to the dais, I knew I had 5, but hearing again the voices of our people that we were upholding, we came out with 7-0. And absolutely, Cynthia was correct. All the things that we were told would happen, loss of business, the city wouldn't grow, our hospitality industry, would suffer tremendously. And 6 years later, none of that materialized. Our hospitality industry grew even stronger with an upward of 19 million visitors to the city of New Orleans. Harris Casino moved forward with their plans for expansion and even a hotel. So I say today that making certain that this city went smoke-free 6 years ago prepared me in every way as mayor in the face of this pandemic to continue to stand tall and firm when it came to the public health and public safety of our citizens, our visitors, and all of the people that we serve. So I'm staying very much committed to that. Public health remains our top priority. We will come out of this pandemic as long as we get vaccinated appropriately, but we will come back stronger and better than we were pre-COVID. I have no doubt in my mind, but it's truly rooted and grounded in the work that we did 6 years ago, upholding the public health of our community. And there is not a day that goes by, quite frankly, that I am not thanked on the streets from employees, musicians, residents, you name it, who say, thank you for choosing me over everything else. So thank you again for having me. I want to encourage all those who have not gone smoke-free in your communities, take it on, face the challenge in order to correct it for your people, because everyone will benefit from it. So thank you again.
Thank you so much, Mayor Cantrell. Can you help me out? And who is next on our agenda?
Yes, we're excited to have Carissa Holmes from the CDC.
Hi, everyone. Thank you so much for the opportunity to talk to you today about the harms of secondhand smoke and the benefits of going smoke-free. This hits home for us here at CDC because one of our Tips from Former Smoker campaign ad participants, Nathan Moose, worked in a casino and was exposed to secondhand smoke on the job day in and day out. He never smoked, but developed asthma and eventually lung damage from that secondhand smoke exposure that killed him in 2013. He was 54 years old. There is no risk-free level of secondhand smoke exposure. The only way to completely eliminate this risk is to eliminate smoking indoors, separating smokers from non-smokers, having designated indoor smoking areas, having ventilation. None of those are effective to completely eliminate the risk. And the risks are serious. So secondhand smoke causes heart disease, strokes, lung cancer, and respiratory disease. And these can happen very quickly. Even short exposures can and do cause heart attacks. We know that as Cynthia mentioned, the hospitality industry is particularly vulnerable here. So Folks that work in restaurants, bars, yes, casinos are exposed to secondhand smoke at much higher rates than the rest of the US population. And this framing of going smoke-free is not new. We've been saying this since the 2006 Surgeon General's report, which did conclude that there is no risk-free level of secondhand smoke exposure, and that there are incredible benefits to going smoke-free. We've seen smoke-free policies effectively eliminate this risk, but they have additional benefits. They encourage people in the community to quit smoking. They reduce healthcare costs. They encourage kids who see the policies being implemented to not start using tobacco, and they reduce health disparities. And 3 out of 4 casino patrons want to play in smoke-free casinos. So going smoke-free is a win for health, and it's a win for business. Thank you.
Thank you, Carissa. We appreciate that very much. Brian Christopher is our next speaker. Brian, if you could introduce yourself, and we look forward to your remarks.
Thank you very much. My name is Brian Christopher, and I host a YouTube channel and Facebook page. I have over 700,000 followers on there, where I upload videos from casinos every single day of the week, multiple times actually, and go live from casinos holding many events with our fans. So we're very close in touch with our fans, talking with them all the time. And one of their biggest concerns is smoking in casinos. And if you can hear it in my voice, I've been in smoking casinos for the last couple of weeks. And it does affect me. And I'm always using lozenges and coughing because of it. So we decided to do a survey with our fans and open it up to the public to find out what everyone feels like when it comes to smoking. Statistically, we knew that 13% of the US population were smokers, but everyone thinks that when it comes down to gamblers, that they're all smokers as well. What we found out was about 19% of respondents were actually smokers, but of them, a majority actually still preferred non-smoking casinos, which is interesting. But when you think about it, like how many of them actually smoke in their own houses? Majority probably don't, because it's gross. It is in your clothing, it's in your hair, and you're always breathing it in. And so it's a 95% of respondents preferred not to be in a smoking casino. They would choose a non-smoking over a smoking casino. The number one audience that casinos are trying to attract right now are millennials, the younger people, bringing them in. And if you think about it, millennials, many of them, or even the next generation, did not grow up with cigarette smoke anywhere. Their first exposure to it is in a casino. So the moment they walk in, they're hit with this waft of smoke. It is not a nice thing to walk into, and that's not going to keep them there either. That's like I said, it's the only time that they've ever come across that. During the pandemic, many casinos decided to go smoke-free, and after speaking with some casinos, Angel of the Winds was one of them. She mentioned as they went smoke-free, they saw an increase in younger patrons coming in, more people playing on their players cards, and overall biggest growth ever. And we've seen that in many, many casinos are having their biggest months of all time right now, even after going smoke-free. I'm from Canada originally, and when I came to the States 7 years ago, I was shocked that they were still smoking in casinos. And I do remember the time when we changed from bars and restaurants from going smoking to non-smoking, and the uproar that came with it. Everyone said the bars are going to close, the restaurants are going to go out of business, but it just doesn't happen. It does not happen that way. People still got to eat, they still got to drink, and guess what? They still got to gamble as well. And this is definitely not a gamble you want to do, and that's why I partner with the association to promote non-smoking in casinos. And those are the types of casinos that I wish to promote going forward.
Thank you so much, Brian. I appreciate that. Next up, we are joined by a friend of ours, a very brave employee from Navajo Nation, who will remain anonymous. It is unfortunate that when employees speak up, they risk the potential of losing their job or facing some sort of backlash. So I'd like to now turn the microphone over to our brave and wonderful friend who's here to share their story.
Yeah, my experience in working within the Navajo casino has been great, despite the secondhand smoke, which affected my eyes and smell. sometimes it gives me, well, it did give me headaches and make me cough. And that was bad for my health since I'm diabetic. And the secondhand smoke impact my blood level and my heart rate, which to me, that is a serious concern for me and others that are diabetic. And the Navajo casino, they reopened certain casinos that 100% smoke free. I feel that is very a positive decision for our people and our workers and our visitors that come to the casino, especially the elders and the ones who are pre-existing conditions. I think a healthy workplace and in public places is something that is needed, especially with the experience with the COVID-19. We need to protect our people that were impacted by the COVID. And a lot of them, they have different health conditions, and being exposed to secondhand smoke, it's not great for them. Also, listening to some of the people's comments and views of the Navajo casino going smoke-free has been very positive, and I think majority of the people are looking forward to a healthier place and enjoying their entertainment. People will enjoy not having to worry about smoke on their clothes or their hair. I know I'm going to enjoy that. I think people enjoy safe and clean and entertainment, so that will be something I'm looking forward to, and as the people looking forward to being reopened. And also, I believe and hope that reopening 100% smoke-free will become a permanent policy for the Navajo leaders will make that decision. We need to protect our elders with our children by thinking about the future of our health and well-being. As an employee, I look forward to working in a clean and safe place, and I think we're moving forward to a healthier society for following COVID. Health is a priority. In closing, I'd like to thank you all for having me on, and I also like to thank the tribal leaders and the casino industry for making the change to protect the health of their workers and visitors. Breathing clean air is what makes us healthy. I really appreciate it. Thank you, Asheha, for listening.
Many thanks. All of us appreciate you sharing your story. Next up is Missy Tracy from Ho Chunk Gaming to share the story of how their tribal casino has gone smoke-free. Good to see you, Missy.
Oh, thank you, Cynthia. Good morning, everyone. Thank you for having me. It's always such a pleasure to relay our story and encourage other tribal casinos throughout Indian country to go smoke-free. Our story has been a success story that started back in November of 2014, when our executive manager, Dan Brown, had the idea of, based on seeing comment cards regarding the smoke in our casino, the type of environment we were providing our guests. So our marketing department sent out a survey in November of 2014. And we were really surprised to find that the results indicated that exactly the opposite of what we thought to be true, because, several years ago, gambling and smoking seemed to go hand in hand. But what we found out, what our survey indicated, was that 70% of our clientele was in favor of us going smoke-free. So we saw this as an opportunity to really an exercise of our own sovereignty, because our municipality, Madison, Wisconsin, had gone smoke-free 5 years prior. But we weren't mandated to do this. We did this completely of our own volition. So in August of 2015 is when we decided to go smoke-free. And I will say that while we took a 90-day dip, by the 15th month, we exceeded the revenue, and we became our nation's flagship casino, because our nation has several other casinos that did allow smoking. But surprisingly, our head count went down, but our coin-in went up. Thus we became, and still to this day, after we're going on our 6th year here in August, have become leading our nation in terms of our gaming revenue. So while it was a risky decision, because it really lay on the shoulders of our executive manager to actually go ahead and take the leap and do this, if it failed, that would be on him as well. But fortunately, our story is one of a success story. And also, I think, no one could have anticipated the pandemic that that we are still coming out of, but that it's a respiratory virus. All the better to have made this decision to provide a smoke-free, healthy environment for not only your guests, but your casino staff as well. And again, we never look back. And also, I want to say that other casinos throughout the country have been disinfecting and sanitizing their casinos throughout the pandemic or getting ready to open up. And I just want to remind folks that this being smoke-free is another way of protecting that investment, because, surely it's cost a significant amount of money. But, there's no longer that tar and nicotine residue. And you'll also realize cost savings in a number of ways. It reduces illness from your casino staff calling in with, having to reschedule. It also cost savings realized in your HVAC system by not having to change out the filters as frequently. No longer will your environmental services staff have to empty out ashtrays. So it just really is the smart thing to do. And I love telling our story. And and then the other thing I wanted to mention was we also banned electronic devices, so no vaping. And we did that in November of 2019. So all in all, just even anecdotally, based on an employee survey that we did, 51% experienced positive impacts due to, less call-ins, less sickness, based on us being smoke-free. Even while small number, but any number counts, 6.25 stated that that going for them to quit smoking was a deciding factor because of us going smoke-free. Almost 95% employees stated that they prefer to work in a smoke-free environment. 25% says our air quality was a deciding factor in joining our team, so it helps in employee recruitment. And 33%, almost 34% state that they will not work in a smoking casino smoking environment. And then, of course, staff, it's been previously mentioned by others on this call that the smell in your hair and clothes is no longer there. So just encourage everyone, and thank you for allowing me to tell our story. It's always such a pleasure.
Thank you, Missy. Excuse me. It's always important to hear directly from people who have gone through these experiences, because many times we hear this probably will happen, but the reality of what's really experienced is so important to share, because I do think there is a perception that, the fear of the unknown is real. So it's good to hear real stories from people to sort of quell the concern. Our last speaker is the wonderful Mr. Bob Zlotnick, sorry, Bob, with Smokefree AC Atlantic City, to talk to us about his work in Atlantic City. Bob?
Thank you, Cynthia. I'm Bob Zlotnick, Executive Director of Atlantic Prevention Resources and co-founder of the Smoke-Free Atlantic City Coalition. 2 weeks ago, on the boardwalk in Atlantic City, we celebrated the 15th anniversary of New Jersey's Smoke-Free Air Act that permanently protected more than 99% of workers here in New Jersey. And it's widely considered to have significantly improved public health outcomes here in the state. This law eliminated smoking in virtually all workplaces in the state, including all bars and restaurants. And it was originally intended, when it was written, to protect all workers in the state, but not everyone was included. After 15 years, casinos are still exempt from the law. And until last year, employees continued to risk their health to earn a paycheck. Nobody misses smoky bars and restaurants here in New Jersey. And all the employees of those establishments have been protected for 15 years of this law. Now is the time to address the casino workers that have been left out. They don't have the same permanent protection. Through executive order, Governor Murphy instituted in July of 2020 a smoking ban, a temporary smoking ban. We are trying to make that permanent at this point. We've been working with casino employees and national and local groups to try to encourage passage of a law that would remove the exemption in the state law. Thank you.
Wonderful. Thank you, Bob. It looks like go ahead, Chris, were you going to ask further questions now?
Yes, thank you all for your remarks. And we have a couple of reporter questions that I wanted to turn to. The first one from Paola from Fox 43, Harrisburg, Pennsylvania. Please go ahead, Paola, and ask your question.
Hi, I think my question is, Pennsylvania placed a temporary restriction on smoking in casinos. And as the Commonwealth continues to ease those restrictions, I think my question would be, is there any justification for permitting smoking in casinos again? I mean, the casinos have been doing relatively well. So I think that would be my question. Thank you.
Great. Yes, thank you for the question. And I think it's an important one that we all need to consider. Again, given the pandemic, I think that the public is just highly aware of the value of public health policies and that this is a respiratory disease and it's transmitted through respiratory droplets. And clearly when someone engages in smoking or vaping and exhales, there is an increased risk that whether it's a cold or a virus could be transmitted in the casino. In addition to the health effects of exposure to secondhand tobacco smoke and the aerosolized vapor from e-cigarettes, we would argue that the casinos should remain smoke-free. I think businesses need to operate differently. And as you noted, Pennsylvania is one of the states that have actually shown some really wonderful gaming revenue this year. So as businesses have already begun to transition and they've experienced being smoke-free in their environments, we would say that they should do that both for the health and safety of guests and employees, as well as just, public demand for going smoke-free.
Thank you.
Thank you. Next, I'll turn it to Jonathan Salant, New Jersey Advanced Media, for his question.
I guess Bob would be the best person to answer this. Maybe Chris, you too, since you were at AGA. But what needs to be done to get Atlantic City to be permanently smoke-free, the Atlantic City casinos?
Well, a couple things. One, federal legislation could be passed. That's kind of a long shot. Also, there's New Jersey legislation that has been introduced for about 15 years that has not been passed. New Jersey legislation that would remove the exemption in the original Smoke-Free Air Act could cause the casinos to go smoke-free permanently. A regional effort has been undertaken because the casinos believe that they will lose business and lose profit if they voluntarily go smoke-free. So they're not willing to do it unless it is at least covers all of Atlantic City. And also there's a belief that if only Atlantic City were to go smoke-free, which is all of New Jersey, then casinos in Pennsylvania would benefit because they would still allow smoking once the pandemic is over. So there is a regional effort underway to try to adopt policies that cover both New Jersey and Pennsylvania to address the regional aspects of this.
Cynthia or anybody else, I don't know if you have anything else to add to that question.
Well, we have heard historically, so as an organization, Americans for Non-Smokers' Rights and the ANR Foundation have been attending regional and the national gaming meetings in part to kind of learn about the industry. We work at the community level and we view the gaming industry or the casino industry as sort of a unique community. And in hearing some of the arguments, this whole idea of regional competition, we understand, and yet I think that there is certainly an opportunity to, again, you've heard it in New Orleans from the mayor, that when the city went smoke-free, they continue to do business and they are surrounded by other places that are not smoke-free. People go to your town to engage in either the wonderful culture that's in your area or to game. And the idea of people going to another place merely so they could smoke and gamble. You know, we've heard that before with restaurants. We've heard it before with bars. There may be a very, very small percentage that might do that. But the reality is most gamblers don't go far from where they live. They want to be able to gamble or have that entertainment in their own backyard. But again, I think it bodes for, you know, reasons why Pennsylvania should also remain smoke-free. You know, you would not have then the competition of a smoke-free Atlantic City. And keep in mind that there are other neighboring states that do have smoke-free gaming. So you've got New York, there's Massachusetts, you've got Maryland. I mean, many places locally in West Virginia have smoke-free gaming. So that argument about regional competition, while I understand it, it's becoming less of an issue. And I think it's time to just make the right decision, both in terms of public health and for public demand. If the majority of the population doesn't smoke, also if you've got a lot of young adults who I know the gaming industry is really trying to attract into gaming properties for the entertainment, whether it's gambling or the other amenities, most young people don't smoke and they're very health conscious.
I would also add from our respondents on our survey, 88% of smokers preferred non-smoking casinos. 88% of actual smokers. And one point that I failed to mention earlier is casinos just believe that they have more smokers. None of them know. They have no idea because they don't ask. They don't do their own surveys. They don't ask their patrons, are you a smoker or are you not? Which drives me nuts because I have conversations with casinos all the time, and more so right now, and asking them like, would you consider going smoke-free? Oh no, most of our patrons smoke. And I'm like, it's not real. Like, how can you stand by that? Have you asked them? Well, no, you know, when you walk on the floor, there's so much smoke everywhere. Okay, sure. But like I mentioned earlier, 13% of the US smokes. So that is about 1 in 10, one in every 9 people are smoking on the floor. That sounds about right. Or even we found it's more like 19%. So maybe 1 in every 5 has a cigarette in their hand. That I could believe that. You know, when you walk on the floor, you might see 1 in 5 people with a cigarette. To the casino, that sounds like, oh, everybody's smoking. There's so much smoke everywhere. When in reality, 80% of them are not smoking. And I really, really wish casinos would take it into their own hands to ask their patrons what they really want. Because like I said, most smokers actually would prefer a non-smoking casino. And there are some casinos out there who have gone completely smoke-free and introduced a smoking patio with slot machines and with tables. So this open air area where you can still have fun, still have a cigarette, and still get that revenue in if they want to from smokers at the same time.
Thank you, Brian. I know we are running a little bit past time, so we'll get to our last question here. And again, we appreciate everybody taking the time to join us. If there are any questions from reporters that were not answered today, please reach out to me directly. You all should have my email, my cell phone. So last question here, we'll turn it to Reggie with CDC Gaming Reports, not to be confused with Carissa, CDC. Reggie, go ahead.
My question is for Cynthia. Cynthia, why do you think casino operators have failed to do due diligence when it comes to polling customers about smoking? As Brian just mentioned, he's proven that customers prefer non-smoking casinos. What are casinos afraid of besides the bottom line?
Well, that's a very good question. And I don't know why casinos haven't really done this. I do know, again, from attending some of these other meetings, that casinos will often survey their Players Club members to find out what their preferences are. And we have been encouraging them to add questions about, you know, whether they would prefer smoke-free or smoke-filled. We fortunately now have a couple of sample surveys that we can share. Brian Christopher has one that he has shared with surveying his players, the players survey. We've also got one that was designed by one of our consultants, Clinton Isham, who is working with our tribal casinos and designed one for tribal casinos or commercial casinos to use. So we do have some sample questions. It may also be perhaps a fear of finding out that their players would like smoke-free. But we would encourage them to do it because I think that half the battle is, again, the reality versus perception and finding out what do people really want. And we'd be more than happy to help frame questions, or there are others. I'm sure that Missy, again, peer-to-peer tribal casino operator to another, could engage in those kinds of discussions and sharing resources.
Thank you.
And if I could just interject right quick, maybe one of the points we need to pose to these casinos is tell them to start with their comment cards first, which is what we did. And maybe through collecting those comments, they'll see that if they conduct their own survey, they might be very, very surprised, such as we were.
Great, thank you all very much. That will wrap it up now. I just want to say a special thanks to Missy, to Carissa, to Brian, Bob, to our casino worker who joined this call, and obviously to Cynthia. We're grateful for all of your time, and again, follow up if you have any other questions, and we look forward to talking with you all again very soon.